मैं प्रवेश चौहान, फॉर्मली जर्नलिस्ट द ट्रिब्यून, चंडीगढ़ न्यूज़ हब में आप सभी का स्वागत करता हूं। जीवन रक्षक नमस्ते। आज 29 जनवरी 2025 को एक साधारण नमस्ते स्ट्रोक की स्थिति में जीवन बचा सकता है। एक नई तकनीक निश्चित रूप से ऐसा कर सकती है। फोर्टिस अस्पताल मोहाली ने इस पारंपरिक अभिवादन का उपयोग करके प्रारंभिक स्ट्रोक पहचान के प्रति जागरूकता बढ़ाने के लिए एक क्रांतिकारी पहल शुरू की है। इस तकनीक को समझाते हुए प्रसिद्ध न्यूरोलॉजिस्ट डॉक्टर श्री राम वर्धाराजन ने कहा कि एक साधारण नमस्ते तीव्र स्ट्रोक के दौरान जीवन बचा सकता है। नमस्ते करते समय व्यक्ति स्ट्रोक के मुख्य लक्षणों की तुरंत पहचान कर सकता है। दोनों हाथ जोड़ने से बांह की कमजोरी या झुकाव का पता चलता है। सीधे खड़े होकर मुस्कुराने से चेहरे के असंतुलन या गिरावट की पहचान हो सकती है और नमस्ते बोलने की स्पष्ट तोतलाती हुई वाणी का पता चल सकता है। इसके अतिरिक्त आंखें बंद करते समय संतुलन या संवेदनशीलता की समस्या का परीक्षण किया जा सकता है। आओ देखते हैं इससे संबंधित एक रिपोर्ट।
Dr. Vivek Gupta, Additional Director Neurointerventional Radiology, to throw some light on what has been done for stroke awareness, what happens during a stroke, and how this initiative is going to make a change.
Good evening, everyone, and namaste. So, whenever we launch something new, it is always very pertinent to understand from where it is coming. Nothing comes in a day or in a month or in a year. It takes years for some new concept to come. And that is my role today, to talk about what is going on in stroke detection, how a layman, how a public can detect what stroke is. And nothing speaks better than visual cues. So if you can bear with me and have a look at this video, it's a very short one minute video. Then I will speak.
छील कम रही है, खा ज्यादा रही, बचपन की आदत है तेरी। सुन रही मैं क्या कह रही? क्या कर रहे हो? देखने को दो। आपको इस वक्त पैसों की जरूरत है और आप इस चीज का फायदा उठाना चाहते हैं। दरअसल हमारी कंपनी के जीएमपी इस कंपनी में एग्जीक्यूटिव ट्रेनिंग। मम्मा से गिर रहा है, बोल भी नहीं पा रही है। ये लग पा तो नहीं है। मम्मा, हाँ जी, एम्बुलेंस चाहिए इमीडिएटली भेजिए।
हमें स्ट्रोक आया था, आप उन्हें सही वक्त पे ले आई। हमने उनकी जान बचा ली है और परमानेंट पैरालिसिस से भी बचा ली है। शी इज फाइन नाउ, रिलैक्स।
से गिरना, बात ना कर पाना, शरीर का एक तरफ से नम हो जाना, लकवा या पैरालिसिस, ये सब स्ट्रोक या ब्रेन अटैक के लक्षण हैं। सही समय पर सही अस्पताल ना पहुंच पाना जानलेवा हो सकता है।
So this is how stroke, And it's not an uncommon disease. If we look at the World Stroke Association's data, 1 in 4 people have a risk of having a stroke in their lifetime. 1 in 4 means out of 50 people, more than 10 people would suffer stroke during their lifetime if they are not taking adequate precautions. और ये सिर्फ वर्ल्ड का डेटा नहीं है. अगर हम इंडिया का पिछला 30 इयर्स का डेटा निकाल के देखते हैं तो देयर इज ऑलमोस्ट 50% इंक्रीज इन द इंसिडेंस ऑफ स्ट्रोक. So which tells us it is not uncommon, it is very common for that matter. And अगर हम अपने रीजन का, अपना रीजन मीन्स नॉर्थ ऑफ दिल्ली देखते हैं, पंजाब हरियाणा देखते हैं, so this shows the incidence which shows the color. So deeper the color, higher is the incidence. So हमारा जो रीजन है, that again is a stroke prone region. So this is the background of stroke, how common it is worldwide, in India, in our region. So the major importance here is to detect how a stroke looks like. और इसके लिए we have been following a mnemonic known as B fast: balance, eyes, face, arm, speech and time. It's not first time in India something has been done. Initially a concept came as बचाव, बाजू, चेहरा, आवाज़ और वक्त. अगर इनमें बाजू, चेहरा, आवाज़ में किसी में भी फ़र्क आता है तो स्ट्रोक हो सकता है, but it did not catch on because it was difficult to remember. So something new had to come, and something new had to come which was tailored for our Indian population, अपनी language में जो लोग easily समझ सकें. So as our government says, something made in India, make in India. So what is that new concept which has you what this Namaste is all about? Please, Dr. Mohali.
Now we have a concept of Namaste. So Namaste, just a simple Namaste, which is our daily greeting, can help us identify whether the patient is having early symptoms of stroke or not. So I'll just demonstrate to you how this concept of Namaste works. So in case you feel that the patient is having stroke or early symptoms of stroke, we have to tell the patient just to stand and to oppose the hands in form of Namaste. So what the patient is doing abduction at the shoulder, flexion at the elbow joint and extension at the wrist joint. So patient has to stand like this, oppose the hands in the form of Namaste, and in case the patient has weakness of one arm, then that arm would not hold against gravity and that would drift and fall down. So the arm which cannot hold against gravity is the arm which is weaker. Along with this, patient has to smile. So when the patient smiles, we can always see and detect whether the patient has got facial asymmetry or droop. So any sort of facial asymmetry on the face of the patient tells that the patient might be having stroke. And the third thing which the patient has to do is he has to speak Namaste. He has to verbalize and he has to say loudly Namaste. So if the Namaste is not clear, slurred, then the patient might be having dysarthria or aphasia. So this could be early sign of stroke. So 3 things we can decipher from this: the weakness of one arm of the body, looking at the face whether the patient has got any facial asymmetry, and asking the patient to speak Namaste to see whether the patient has got any slurred speech or not. Along with this, in case you want to have a more sensitive way of looking at Namaste, the patient has to stand straight and patient can close the eyes. If the patient is standing in Namaste posture and closes the eye, and if the patient sways, then that means that the patient might be having some sensory or vestibular involvement, which could be features of posterior circulation stroke. So this concept of Namaste was brought on by Dr. Vardharajan, and this was published in Neurology India in 2015. So we are launching this because this is a far more easier way to remember, far more traditional, vernacular, and it is something which we do on a daily basis. This is our daily greeting. So this is far more easier to remember than to remember fast or be fast, which is more of a westernized concept. So that is about Namaste and how to find out early signs of stroke from Namaste. So it is a dangerous disease like heart attack. It happens suddenly. Normally it occurs because of stoppage of blood supply through a vessel which supplies an area of the brain. So that causes infarction of an area of the brain. That infarction is what causes symptoms to the patient. So every second is important. We have around 100 billion neurons in the brain. 1 second delay in revascularization causes loss of approximately 32,000 brain cells. 1 minute loss in revascularization causes loss of approximately 1.9 million neurons. So every minute counts. 1 minute delay in revascularization causes loss of approximately 1.9 million cells. Such an important thing. Treatment is available and treatment is time bound. If the patient has any symptom of stroke, we must get the patient to the hospital ASAP. First 1 hour is the golden hour, but we can give treatment to the patient in the form of an injection, which is called IV thrombolysis, till 4.5 hours. But what we have to remember is, having more time does not mean that the patient should take more time. So as soon as the patient has symptoms, they should reach the hospital ASAP and should not waste time. We have a drug which is called Altiplase, and now we have another drug which is approved as Tenecteplase. Both the drugs can be given to the patient within 4.5 hours of symptom onset. What we have to remember is, if the patient comes within 90 minutes, if we give Altiplase or Tenecteplase to 4 patients, 1 patient has a very good outcome. If that time is delayed till 3 hours, we require 9 patients to be given Altiplase for 1 patient to have a good outcome. So time is of essence, time is important, time is brain. So that is the core, that's the crux of this, that the patient should not be wasting time. This drug, what the drug does is, it dissolves the clot that blocks the blood flow in the brain and reduces the chances of death and disability. But again, it has to be administered as soon as possible. Early treatment can save the patient from disability and increases chances of successful recovery. So we have to act fast to save patients' life. Thank you so much.
Fortis launching this Namaste for early detection of ischemic stroke. We will be able to help more and more patients. Dr. Kushbu.
Obviously, Namaste has been an old word used for greeting each other, but the man behind the concept of Namaste for stroke awareness, Dr. Sriram Vardarajan, a young neurologist from the south of India. And I would request Dr. Nishit Saval to please kindly introduce him to our audience.
Namaste, आप सब लोगों को पता होगा, when COVID was rampant, so Namaste was the preferred thing. तब बोलते थे नमस्ते करो, हैंडशेक मत करो, हैंडशेक से वायरस फैलेगा. Another use of Namaste which Sriram has done. Sriram is a good friend. He is a neuroradiologist. Sriram is a neuroradiologist from NIMHANS, extensively trained abroad, India. He's trained in Switzerland. He was recently doing a 1-year fellowship in Canada. He works in Coimbatore. Sriram was, after finishing his DM from NIMHANS in neuroradiology, Sriram was in CMC Ludhiana for 3-4 years, and then he went back to Coimbatore. So Sriram is a good friend and a very dedicated, passionate neuroradiologist. Some people have the passion. Stroke basically वो है ना, भगवान इंद्र के हाथ में वज्र है, तो स्ट्रोक को हिंदी में पक्षाघात बोलते हैं. पक्षाघात मतलब एक साइड का पक्ष आपका खराब हो गया. हेमीपेरेसिस स्ट्रोक हमेशा यूजुअली एक साइड को लेता है, तो वज्राघात भी बोल सकते हैं, क्योंकि स्ट्रोक इज सडन. चलता पेशेंट एक साइड जाएगी, इट्स लाइक दैट्स व्हाई इट्स कॉल्ड स्ट्रोक. सो जिस तरह बीमारी एकदम आती है, it strokes you, it hits you like a bolt of lightning. So treatment has also been sought on the same theme. जितना जल्दी इलाज शुरू होगा, चाहे IVTP है, चाहे मैकेनिकल थ्रोम्बेक्टमी, the better results are, and that's where Sriram has come in. Because हमारे पास पेशेंट्स आते हैं, वो बोलते हैं सर हमें समझ नहीं आया, हमने 1 घंटा वेस्ट कर दिया, हमने पेशेंट को पानी पिलाया, ग्लूकोज पिलाया. All this happens and this has to be discouraged, because unfortunately stroke पेशेंट की एक साइड नहीं खराब करता, वो पेशेंट हमेशा के लिए डिपेंडेंट हो जाएगा, पैसे नहीं कमा पाएगा. ऑल दिस हैपेंस. सो kudos to Sriram for developing this Namaste test, where he is based. Probably they'll be saying Vanakkam. He's in Tamil Nadu, so वहाँ पे Namaste को Vanakkam बोलते हैं. So he has been training and he has also now devised. He's also very passionate about spreading the word. Awareness फैलाने में भी उसका बहुत फोकस है. तो अभी उन्होंने रिसेंटली श्रीराम ने ग्रुप्स बनाए हैं ताकि डॉक्टर्स के, ताकि उनको exactly aware किया जाए, and उसके बाद it will percolate down to the society. So he's basically trained extensively from Chennai and then abroad, and I think we'll be able to get him on the Zoom call. Technology allows that, so we'll be able to meet not in person but over this teleradiology to Sriram. Thank you. This is the paper which he published actually, and I was at GMC 32 when I first met Sriram. तो मैं हमेशा उसको बोलता था यार तू इसको प्रमोट नहीं करता है. This is a beautiful idea which you are just letting go waste. He was working on it, but I am extremely grateful to Fortis कि we are able to, मतलब it's a beautiful concept, simple सा cultural, जैसे डॉक्टर मान ने बताया कि it's a cultural thing. नमस्ते से ही हम स्ट्रोक के सारे साइंस आइडेंटिफाई कर सकते हैं, प्रोबेबली बेटर देन बी फास्ट. बी फास्ट वॉज डिवाइस्ड इन यूके, इंग्लैंड, और उनकी अपनी स्टडीज है कि उनको बी फास्ट से बहुत ज्यादा फायदा नहीं हुआ है. उनकी अपनी स्टडीज है कि पीपल रिमेंबर इट बट पीपल डोंट रिकॉल इट एंड पीपल आर अनेबल टू एसोसिएट. So the thing has to be something in the form of a greeting. It makes things much more simpler. So this is his publication, and probably we'll hear from the master himself. Thank you.
This was a concept that's almost 10 years old now. And I, rather than identifying myself as a neuroradiologist or a neurologist, I think my identity in stroke goes back to being a stroke survivor myself. I had a stroke when I was 17, when I was in the first year of medical school. And since then, it's just been a constant, I would say, passion, some call it obsession, to try to make some kind of difference in stroke and for stroke patients wherever I work. And following my DM in 2016 from MANS, I was fortunate to actually work in CNC Ludhiana and in Punjab. Punjab is way ahead, even during that time, in terms of data. Thanks to Dr. Jayad sir. And हमारे पास काफी सारा data है, epidemiology and population-based data about stroke. And unfortunately, I used to say, "Don't be the one and fix the sal pehle," and now the slogan has become one and four. So whatever we are trying to do, obviously we are unable to slow down this silent epidemic. And ज़्यादा worrisome ये है कि the data that came out also said the risks and the incidence and the prevalence are the same, if not bad or worse, in the rural communities. And we also know about the female versus the male preponderance and the increasing incidence of strokes in young patients. So I think the burden is well known, and as I'm transitioning more towards an admin kind of role in stroke, we are identifying roadblocks. And the most important roadblock that I see is in the pre-hospital stage. हमारे पास अभी काफी अच्छी facilities है. We got the best of the best specialists, tier 1 and even tier 2, and even percolating to tier 3 cities. We now have at least 1 or 2 interventionalists who can afford give them coverage for endovascular therapy. But what has not changed is probably the awareness at the public level. And I believe that this goes a long way if we can have a traditional thing incorporated into the detection or a triage kind of situation. And more importantly, we have to get the message across, probably if not more than what would happen for a cardiac arrest. जहाँ पे भी हम देखेंगे तो हम आजकल न्यूज becomes very viral that जिम में sudden cardiac arrest हो गया, somebody collapsed while giving a speech. Unfortunately, because maybe it is associated with negative symptoms and there is a lack of pain many of the times, except when there is a shake and a severe headache, stroke patients tend to have more of weakness. And maybe that is a negative sign that goes in maybe giving a false sense of the symptom. The symptom starts in a mild manner, and PIA becomes a huge burden. And the data is very clear. Even other minor stroke symptoms, so they are at risk in the next 24 to 48 hours. 1 in 3 of them can go on to develop a major stroke. So the emphasis here is to get the message across to the general public, and hope to at least create an impact in at least able to, if not reducing, but at least stabilizing the incidence and prevalence of this epidemic. So I believe Namaste or any indigenous forms of awareness campaigns goes a long way in addressing the roadblock that is there at the pre-hospital stage. And we should probably look at the countries that are ahead of us. India is on its way to being a very well established force to reckon with in most of the fields, and state should happen in healthcare. We should probably be showing the way in terms of research and epidemiological data, as well as reducing the community burden of such diseases, which has got a tremendous social impact. Most of the young patients are family, and it creates such a big change in the lives of not just the patient but the entire family. They become bedridden and go into death, and creates a huge burden to the society and the country. The concept itself took shape when I was on a train journey as a DM resident, and I just kind of realized we could maybe incorporate the hand, the face, the leg part of it. If we can ask them to self-evaluate themselves, maybe something similar to a breast self-examination that many people advise for early detection of breast CAs. If they have a doubt, all you have to do is to go and stand in front of the mirror, even if there is nobody around you. And being fast was modified to incorporate balance and eye. And I think having a test that could be evaluated in the upright position can also help us look at the balance part of it. I still think we have to validate this internally and also externally. But the starting point is to help create more awareness about the stroke itself and the increasing burden of stroke in the society. And I again thank Fortis and Dr. Mr. for kind of driving this forward. And I'm just happy to be of any help in this endeavor. Thank you so much.
Namaste launched at Fortis Hospital, Mohali. सर, ये जो आज जो नमस्ते आपने लॉन्च किया, क्या इसके ऊपर कोई रिसर्च या कोई एक्सपेरिमेंट हुए हैं?
नहीं बोल रहा जो स्ट्रोक के लिए नहीं हो, ये एक ऐसी चीज़ बोल रहा है जो पहले थी लेकिन इंडियन पॉपुलेशन के हिसाब से टेलर्ड नहीं थी। पहले फास्ट था, फास्ट पे रिसर्च हुई, उसने बताया कि अराउंड 50 to 60% स्ट्रोक के साइंस ये डिटेक्ट करता है, पर फिर भी 30-40% पेशेंट्स को नहीं वो फिट हो रहा था। फिर इसको मॉडिफाई किया गया 10 साल लेटर बी फास्ट में, बैलेंस और आइज उसमें ऐड किया गया। नमस्ते जो है उसका इंडियनाइज्ड वर्जन। एज फार एज योर स्पेसिफिक क्वेश्चन की क्या कोई रिसर्च हुई है, द फाउंडर इटसेल्फ सेड कि इट नीड्स टू बी वैलिडेटेड। वैलिडेटेड का मतलब कि जब पूरा देश इसको यूज़ करने लगेगा उसके बाद हमें पता चलेगा कि क्या कोई स्ट्रोक के पेशेंट इसमें से छूटते हैं कि नहीं। सो फर्स्ट इट हैज़ टू बी अडॉप्टेड, देन इट विल बी वैलिडेटेड।
सर स्टॉप तो जैसे जैसे हमारी एज बढ़ती जाती है, आफ्टर द एज ऑफ 55 एवरी डेकेड इन आवर लाइफ स्ट्रोक का रिस्क डबल होता जाता है। 55 से 65 के बीच में स्ट्रोक का रिस्क डबल हो जाएगा। मेल जेंडर को ज़्यादा स्ट्रोक होता है, जो थोड़े अफ्रीकन अमेरिकन हैं उनको स्ट्रोक ज़्यादा होता है। तो दीज आर नॉन मॉडिफाइबल रिस्क फैक्टर्स, इनके बारे में हम कुछ नहीं कर सकते। देयर इज नथिंग वी कैन डू अबाउट दिस। सो मॉडिफाइबल रिस्क फैक्टर जिनके बारे में हम कुछ कर सकते हैं, सबसे कॉमन बात हाइपरटेंशन। बीपी के पेशेंट अपनी दवाई कॉमनली नहीं लेते हैं। बीपी एंड शुगर आर साइलेंट किलर्स। तो जब तक आपको बीपी के लक्षण आएंगे तब तक वो देर हो चुकी है ऑलरेडी। सो किसी को बीपी है, बीपी की दवाई रेगुलर खानी है। सिर्फ बीपी आपका 10 mm मर्करी कम होता है तो आपका स्ट्रोक का रिस्क 40% कम होता है, राइट। जिनको डायबिटीज़ है, डायबिटीज़ कंट्रोल में रखनी है। स्मोकिंग है तो स्मोकिंग हैज़ टू बी स्टॉप्ड। स्मोकिंग आज छोड़ते हैं तो 5 साल लगते हैं उसको नॉर्मल होने के लिए। अल्कोहल है तो यू शुड स्टॉप अल्कोहल, और एट द मोस्ट हैव 2 small drinks, that too only 5 days in a week. But we prefer not to tell that to the patients because 2 के 4 कब होंगे पता नहीं। So and have a healthy lifestyle, आपका weight in control रहे, आप exercise कीजिए, cardiac problem है, atrial fibrillation है तो उसका ट्रीटमेंट कीजिए। बेसिकली स्ट्रोक प्रिवेंशन के लिए जो हार्ट की प्रॉब्लम के लिए जैसे कार्डियक के लिए होता है, सेम इशू है। डायबिटीज, हाइपरटेंशन, स्मोकिंग, अल्कोहल, ओबेसिटी, लिपिड्स एंड हेल्दी लाइफस्टाइल, ये सब चीज़ें हैं प्रिवेंट करने के लिए।
है कि यंग में जल्दी हो गया। मैंने स्ट्रोक इन यंग शुरू किया था स्टडी करना 1973 में। उस समय हमने 1000 पेशेंट देखे थे, उसमें से 22% जो पेशेंट थे वो लेस देन 40 ईयर्स के थे। सो इसका मतलब है कि अगर आप ध्यान से देखना शुरू करो तो 1973 में भी ये 20% होता था। अब ये 20 से 25% हो गया है, क्योंकि हम पिज़्ज़े खाते हैं, बर्गर खाते हैं, टीवी के सामने बैठे रहते हैं, अपने रील्स देखते हैं और सैर करते नहीं हैं। इससे बढ़ रहा है। बीपी तो दवाइयाँ भी आ गई हैं, शुगर की दवाइयाँ भी आ गई हैं, लेकिन जितनी दवाइयाँ इतनी आ रही हैं, बीमारी इतनी बढ़ रही है। सो दैट इज़ व्हाट इज़ हैपनिंग। सो स्ट्रोक इन यंग हैज़ इंक्रीज, बट इट इज़ नॉट इंक्रीज टू दैट एक्सटेंट कि आप कहो जी कि क्या कारण हो गया है। कारण तो पहले भी थे, अब भी हैं, लेकिन थोड़े अब जनता जो है वो हो गई है समझदार। उनको पता लगने लग गया कि हाँ भाई ये स्ट्रोक होता है। नमस्ते का मतलब यही है कि हम और यंग और ओल्ड बंदे जो है उसमें निकाल सकें।
Please like, share and subscribe my channel. Thank you.